African immigrants and their families. And our vision over the past 16 years has always been to to ensure that people access quality healthcare for all African immigrants. And today we have a very interesting topic and a very interesting resource person who is going to be doing justice to the topic for today. So today we're going to be talking about measures to reduce the spread of COVID-19 among African Americans and African immigrant communities. And we have someone very interesting. Her name is Hellen Fissihaie. Is that how your name is pronounced? Pardon me, please.
Chris. Yes, you did a great job. Thank you for having me.
All right. All right, great. So Helen is an Eritrean by origin. She was born in Sudan and was raised in Dallas, Texas, here in the USA. She's currently residing in Washington, D.C., and she has worked across the globe in a variety of capacities and currently owns and operates F3 Global Advisory Group, LLC, a company, a capacity building, strategic planning, and marketing entry firm based in DC that is focused on health, agriculture, and entrepreneurship for private and public sector clients in the US, Africa, Middle East, and the Caribbean, servicing women and youths. Ms. Helen continues to help drive diasporans into the continents to ensure that experts return to their homeland and bridges are built for Africa with other international actors and markets. She continues to support innovative millennial entrepreneurs disrupting markets in Uganda, Ethiopia, Tanzania, and Nigeria by fundraising, investing, and connecting partners and business actors. She serves as a city commissioner for the DC Mayor's Office on African Affairs, advisory board member for Diaspora Rise Up, and Grid to Grid, and mentors a variety of youth and Mandela Yearly Fellows annually. You're welcome, Helen. This is not all of Helen's bio. I had to just shorten it. She's actually doing a lot, and it's very, very interesting. You're welcome, Helen, to today's webinar.
Thank you for having me, and thank you. I love this organization. It's one of my favorites, and I greatly support a lot of the work that you guys do. So thank you for having me today.
Thank you very much. Okay, so we're going to go straight to the topic that we have today, and that is measures to reduce the spread of COVID-19 among African Americans and African immigrant communities. So let's start with the impact of COVID-19 on the DC community, because we know that since the emergence of the virus and since it was declared a global pandemic, a lot of things have happened across, Washington, D.C. and across the U.S. entirely. So what are the impact, or what has been the impact of COVID-19 on the D.C. community?
Right. So, definitely the number one impact is obviously the loss of lives, right? And so I think one of the first things that we have to acknowledge is that this is a very serious crisis in the world. And it's not just affecting us, it's all over the world. I think just how we handled it is just a measure of where we are today. In the DC area specifically, we've seen businesses shut down. We've seen unemployment greatly increase. We've seen a lot of different impacts to our city. We're a small city, that's the other thing. And so it's very hard to avoid people, right? If you live in Texas, it's very easy to social isolate. But if you live in a city like DC, where you're using the metro or using the bus system to get to work, it's very hard to socially distance. Also, our restaurants, cafes, homes are a lot smaller and denser. And so that in itself creates another level of problems. In DC, we've seen obviously the lives lost. And I think the number today is like 625 people have died as of now, as of October 22nd. But I think we're doing a much better job, or we have done a decent job and doing our very best to make sure that people are wearing masks, that there are resources available in the community, and that when people need them, they become accessible. I wouldn't say we've done the best, right? but we have done a decent job of trying to make sure those resources are available and that people are educated. One of the number one things that I see daily, right, I work with a lot of small entrepreneurs and businesses and local, is that a lot of them have had to shut down. Obviously, they were impacted when there was the full quarantine. So that impacted people's day-to-day income, right? We did not, I mean, we've only gotten one check from the federal government, which 1,200 in DC really barely covers anybody's rent, honestly. And so there are resources that we need more of, but again, we've seen a lot. I mean, personally, I've seen a lot of businesses shut down. Not even just after like we were able to open back to stage 1 and now we're in phase 2. There were businesses who just said, you know what, I can't make it, I can't keep this up. And so one thing I did see that was really helpful is that the city has given out a lot of like grants and funding, to small businesses. There's still more money coming out for small businesses that are more local, that are DC oriented dollars and that are private sector dollars. So that I'm happy to see that. And I'm happy to see that the number of small businesses reaching out to DCSBA and just all of the different like resources has grown tremendously. I have friends over in some of these agencies, and they're telling me that like the number of, small business owners that they've dealt with has increased almost threefold. Looking for support. Companies are locally trying to diversify, just even the ways that they do business, right? So if one door closes, trying to open up another. There's also the health impact and the resource impact. Small nonprofits are also suffering because some of the dollars are getting cut or budgets are getting cut. The city hasn't been able to, work at its full 100% capacity. And so budgets have been getting cut. I would say like the three major impacts is obviously employment, right? Our health, we're definitely being impacted in all kinds of health ways. And our small businesses, those are the impacts that I'm seeing day to day.
Wow, that's a huge impact. Talking about unemployment, that's a big deal, because once it happens to one person in a family, it affects every member of the family. Health is another issue. Small businesses another issue. So these impacts, and of course, if we look at Washington DC is a dynamic community. Diverse, people, diverse businesses, diverse nonprofits, and the impact is just cutting across everyone. Yeah, and it's something that we as a people, both organization wise and the government, everyone is trying to see how we can actually ensure that the impact of this pandemic is reduced as much as possible. So talking about the dynamism of people living in DC or the city of DC, one thing is very important is the fact that transportation or means of mobility, which is the train, is there, and people, there are restaurants, there are group of places to go to where people gather, and they still need to really also emphasize the importance of personal attitude and knowledge in terms of measures that individuals can take to prevent or mitigate the spread of the virus. So we want to reiterate that. I know that a lot of times people get all of this information every single time, but it's important that we reiterate it. So what are the measures, that individuals can take, to stop or mitigate the spread of the virus in Washington, D.C., considering how dynamic the city is, considering how the population mobility is, and all of that?
Right. I think we all kind of know these at this point, but the number one is just wear your masks and be diligent about it, right? So, come on, wear your masks and be diligent about it. The first thing that people, have been told is, we know that wearing the masks keeps us safer, right? The be diligent part is the part I want to stretch. I noticed that when people wear their masks, they take it off once they get comfortable in that space, or they see someone that they want to hug and kiss. But at the end of the day, it doesn't make any sense if you're wearing your mask just part of the time. So just wear your mask. Wash your hands consistently. Obviously, there's sanitizers are being sold everywhere. Whenever you get home, wash your hands. Whenever you're at a place, wash your hands. Just wash your hands. We all know that that's very important. And then I think going the extra step and just maintaining social distance whenever possible. I know it's not that easy, especially in a place like DC where you're walking on streets where there's a bunch of other people that are coming across you, or you're on a metro and there's other people near you. And in that case, just make sure you have your mask on the entire time. Try to maintain social distance. These things are all preventative. They're not meant to be 100% surefire ways, but the more you include as many of these as possible, I think the better chance you stand for staying healthy. And then the other part is take care of yourself and be healthy. We know that COVID-19 especially impacts our Black and African diaspora community a great deal just because of the health disparities that we have. So it's important that we recognize that eating healthy, maintaining exercise, taking your vitamins, and just staying in good mental health. I mean, it's hard. I know it's not that easy to say these things, but we got to do our best. Work out at home if you can, take walks if you can. There are resources in the city for mental health. Get on webinars where you can learn about healthy eating or what vitamins you need the most during this time. Just keep up your immune system. And then staying home if you feel sick. And this is the part that I've seen recently not happen. I know a lot of us can't afford to take a lot of sick days because we need the work, we need the income. But it is very important that if you're sick, that you let your boss know, that you educate yourself and others in your community, and that you do your very best to stay away from others and isolate or quarantine in whatever way possible. And then just be considerate of others, especially our elders and those who have compromised health systems. It's not the battle against COVID is not going to be won by ourselves. It's a community thing. And the only way we can basically get off of this crisis is that if we work together and we're mindful of other people's needs, and then just be knowledgeable, learn facts versus hearsay. One of the challenges in the beginning was that there was a lot of, what is COVID? What's right? What's wrong? What can you do? What can't you do? Is it viral? Is it not viral? There was a lot of confusion, information, misinformation. So, take the time out to educate yourself, get on platforms where the people are knowledgeable, you can always go to coronavirus.dc.gov. It's DC's coronavirus page, and it educates you and updates you on everything that you should be doing, could be doing, the resources and any educational platforms you need to know about.
Yeah, thank you very much for reiterating that fact. We needed to hear it again because a lot of times, like you said, you get comfortable and you just remove your mask. We need to keep hearing this until it sticks and it becomes a part of us, because this was not the way we were used to living. So it's something that we just have to get used to and be conscious of every single time. So for me, I don't get tired of actually sharing, what one needs to do to ensure that we keep safe. So I'm going to ask something else. It's still related to, the measures of, we're trying to use to stop or spread the spread of the virus. But then we're looking at what are the factors so far that has contributed to the spread of the virus until now, especially in Washington, D.C. Because I, for one, I know that there was a time that there was, the Black Lives Matter, protests across DC. That brought a lot of population together, a lot of people together. And I think that, for me personally, I think that also contributed to the spread. But looking at the work that you've been doing so far, in DC and all of that, what do you think are also the factors that have contributed to the spread of the virus until now?
I mean, that's a complex question because I think there's been so many different levels and layers, and it's pretty complex, from just the way it was handled from the federal government, acknowledging it early, and then just getting access to the different PPEs the communities needed, to, like you said, right? With the Black Lives Matter situation, I think, again, I can't be sure, and I think there's data on this even that people can Google and find out. But I think a lot of that really didn't contribute as much to the number and growth, right? Because they did say that people were wearing their masks. At the end of the day, right? There's so many different factors. Some of us can't afford to stay home, right? So we're going to naturally go to work because it's survival for a lot of, actually it's survival for a lot of people, regardless of what income status you are or where you are. Businesses have to move, people have to work. There's only so much time you can take off before the next due or the next bill is due. So there's a variety of different factors. Also just education, like a lot of people knew what to do, but I don't know if they were fully convinced that that was exactly what they should be doing. You know, a lot of people had a lot of misinformation. I noticed, you know, people were constantly saying, oh, Corona's not real. You know, other people, and I'm like, so there was this war in the beginning, and I think now we know the Corona is real, right? I hope.
Yeah.
But there was a lot of,
Yeah.
you know, argument of, is Corona real, or these stats are real, or hospitals are really doing this, or like, and I would see it on Facebook, I would see it online, I would hear people that are very intelligent, even like arguing those cases. And I'm just like, whether it's real or not real, whether you believe it or don't believe it, people are still dying. And this is something that we don't know, right? And it's dangerous when you don't know something, because if you don't know how to battle it. You don't know what exactly to do. So if we know that wearing our masks, washing our hands, socially distancing ourselves, and being active to protect our health are things that would increase our inability to catch it or increase our ability to stay healthy in this crisis, then why wouldn't we do those things, right? And we know that the city has resources that I don't think, especially Black Americans or African communities, are actually tapping into. DC has a ton of resources, whether you're a small business, whether you're looking for housing, whether you need a quarantine space, and we're just not tapping into it. Part of it is we don't know, right? And the other part of it is that when we do know and we do try to reach out, there may not be the best facilitation of getting that information to you or getting that resource to you, which is where I think organizations like yours play a role, because you guys are credible messengers, you guys are connected to community, you do have a relationship with DC government, you do have a relationship with resources. And so when people don't know what to do, they can always come back to you and state their case, state their needs, and then you can help them connect. And so community organizations like yours are very critical, I think, especially right now, more than ever, because you guys are basically like that lifeline for a lot of families, a lot of communities.
Yeah, thank you very much, Helen. You just made something, just a very important statement that I think, we need to explore a little bit, and it's about the resources that are available to us, and we've not been able to tap into them, or tap into as much as possible. What are these resources that are available? You know,
Sure.
I think that will be the first step. Where we know these resources, we can know how to go about, having access to them.
Yeah, no, definitely. I think DC is a really interesting place, right? Because DC is the one of the only, if not the only city where you actually have an office on African affairs. You have an office for African Americans, you have an office for Latinos, you have an office for every community group, right? And those offices' job is to connect you to the resources for the city, to be advocates for you. And so those offices are only as strong as its connection to the community. And so if those offices have strong relationships with the communities, they get more resources. If their community members show up, they get more resources, which then trickles back down or trickles across to their communities. So I think that's one area where you can find resources, find education. You can always call the mayor's office on African affairs if you have a challenge. Then you have, and those offices are connected to organizations like yours and other nonprofits and for-profits that have resources, whether it's grant funding, whether it's educational platforms, whether it's webinars like this, whether it's just, you know what, I need to get a hold of, Department of Health, and I need to contact this agency, and this is the resource that I need, or I have this complaint, or this policy is affecting my business. So those are like direct line of resources. Then every agency has, resources. It's just, and I know DC, honestly, like I know DC web pages can be very complicated. I've tried to navigate them myself. Sometimes I've succeeded, other times I've failed, which is why I said there's these additional resources where you can tap into the Mayor's Office on African Affairs or community groups like yours. But each agency has funding available, right? So I noticed that recently DSLBD, DOES has been giving out money towards, helping grant dollars for small restaurants who are going into the next stage of COVID. So to help winterize their businesses, right? So I think it's like $6,000 for grant funding. Department of Housing actually has resources for those communities and members of their family, where if someone has COVID in your home, and there's a lot of people in your home, but the house is really small, so it's very hard to socially distance or quarantine. You can reach out to Department of Health or Department of Housing and let them know that you might have somebody in your family that has COVID and that you don't have the resource and the space, and they may be able, and they're actually able to help you with hotels and other resources where you can isolate yourself. So we have those resources. Again, the city has a ton of resources. The thing is, I know trying to navigate the city itself and the offices itself can be difficult, but there are hotlines. So all you have to do is really Google. A lot of times if you Google, like I said, coronavirus.dc.gov is a really good resource just because it basically is everything corona related. So the data is there, the stats are there, the agency needs are there, anything related to coronavirus. And then the Office on African Affairs exists for the same purpose right now, is to really help the African community get everything it needs. The other thing is, like, I always say DC is special in that we house all of our embassies here, right? Embassies have resources too. Again, I know with us and the African community, sometimes the political friction can become a challenge, but embassies have been doing a lot of great work. We recently had a stakeholders meeting with you guys, and the ambassador of Sierra Leone was on the call. And so I know, they're doing a great deal of work to educate and inform their community around coronavirus. Same thing, Embassy of Ethiopia. I've engaged with a lot of embassies who are doing a tremendous amount of work to educate their population locally about what's going on and to provide, resources and to collect and to gather. So hopefully that's a starting list of resources here. But there's also a ton of nonprofits.
Yeah, that's okay. Go ahead. Go ahead.
No, I was just gonna say there's also a ton of nonprofits in DC. I'm happy to try to put together a list for you, and maybe you can share with your community of different organizations that are contributing different kind of resources in the city. Whether it's food, there's food banks in the city. Whether it's PPEs, whether it is just education and information and literature. So the city kind of allocates different funds around, and then those same nonprofits work their way around the city to get it to the people that really need it the most.
Thank you very much. This information is really very helpful because I know that a lot of people want to access some of these resources, but they just don't know how to go about it. But it would be nice, if you can send us a list of, organizations that, provide some of the support and resources, that would be really great. So talking about resources and talking about, all of the things that has been happening so far, let's look at the DC government. What has been their efforts so far to mitigate, the spread of the virus? I know they've been doing a lot. Of course, we are also beneficiaries of one of the efforts, that the DC government has actually put in place to ensure that the virus is mitigated. So, could you throw more light on the efforts of the DC government in mitigating the spread of the virus?
Yeah, sure. So I don't work for the city or anything like that. Just want to state that part. But I've seen the city do based around some of the work that we've been doing with the city and in supporting them, I've seen them do a great deal of work. Obviously, like I said, I've seen a lot of grant money going towards providing PPEs to, donor organizations like yours in order to allocate that same resource back into the community. I've also seen contact tracing, I think is one of the parts that they've done the best or that they are working on right now actively. And that's really trying to make sure that people are actually tracing where the next person is, right? So if you're in a restaurant and you have COVID, they're asking restaurants to list every individual's name that enters and phone number. So if that person entered that restaurant that day, then the restaurant can go back and call all of the people that, or can at least provide that information to DC government, and DC can then reach out to them and say, hey, someone was around you that contacted COVID, so it would be great for you to isolate and quarantine if you have any symptoms. If not, just please do that just to be safe and careful. So this is how the city has really been working to try and like get COVID out there, right? Or at least stop COVID. Education, there's been funding that I've seen and just programs that I've seen around educating people on what COVID is, right? Campaigns, online campaigns, virtual campaigns, webinars, discussions about, we kind of have to keep saying the same thing over and over, but it's important until it gets into everybody's minds and it becomes our norm almost, right? That we do have to wear our masks, that we have to wash our hands, that we do need to social distance. So those type of educational, informational pieces are things that I think the city is working on and continues to work on and continues to try and get better. In addition, obviously, like I said, getting resources, right? So whether it's PPEs, whether it's, funding for small businesses, whether it's educational resources to help, train organizations like yours to become, COVID testers or anything like that. There's that piece. The other piece of it is like, which is their biggest push right now, and I've seen it, is contact tracing, right? And contact tracing is really about making sure that each person that tests positive gets a call, and from that call, they are able to update themselves and the city on where their status is, and educate on like where they've recently been, whether they've been with friends or they've been at a restaurant or they sat at a cafe or whatever within that time frame, in order to make sure that we're kind of like tracing these people in a sense. And that way, a lot of times you may be in a space where someone has COVID and you don't know, right? So you might know if your family or your friends has it, but if you're at a cafe, you're at a bookstore, or you're at a restaurant, you don't know who these people are. You don't have any connections to them. You don't have their phone number, their email, or anything. So you won't know. And so, asking these facilities to also track that information is important. That's something I would love to see more on the African community side happen. And then the other piece of it is the education. So like the Credible Messenger program is a program focused on educating people on contact tracing, right? Accurate information, providing them information that they need to know, because there have been like scams and other things that have happened recently. So we want to make sure that when people get a call from a contact tracer, that they're not scared to educate the person and answer all of the questions till they finish. So that's where Credible Messenger program comes in.
Yeah, thank you, Helen. Let's talk a lot more about the Credible Messenger program, because the idea about it is just to ensure that we're able to educate people, or educate the Black community, to ensure that they also build that trust for the DC government, so that when there is a contact tracer who calls them, they're able to cooperate with the person or collaborate with the person to ensure that the results that is required is actually achieved, because trust is really very important. That is what ensures that partnership, that collaboration between communities and the DC government in terms of trying to mitigate the spread of the virus through contact tracing and case investigation. So what is the importance? Because a lot of times we don't know the importance of these things, and that's why and what we're trying to do through this webinar is also to just educate people. What is the importance of contact tracing? What's the importance of case investigation? Because if I call you and I say I need to get your data because someone has reported that you got exposed to them and they are coronavirus positive. So we're trying to just contact trace to ensure that we have enough information, educate you, and to make sure that at the end of the day, if you're feeling somehow or you're not feeling well, you need to call us and all of that. What is the importance of all of this? Because we can be doing something and people don't know why we are doing it, or why it's very important, or why they need to even cooperate with the DC government in terms of contact tracing and case investigation. So what is the importance of this?
Sure, that's a good point, actually. Contact tracing isn't just DC government, it's statewide. The whole nation is doing it. Every state is implementing its own version of contact tracing. And it's important for a couple different reasons. Number one, it gives the city back or the state back the information that it needs to understand, like, what are the patterns? which communities are being affected, what kind of symptoms are people exhibiting, where are they catching it the most, right? If they speak to 100 people and about 60% said I was, out in a restaurant gathering, that's information that the city can take back and implement new policies, provide new resources, identify ways to mitigate restaurant, cases going up. So that information is very important for the city because you can't battle COVID blindly, right? It's already it's already something that we can't see physically, right? So we need all of the information possible to understand the trends, the patterns, where are people going, how are people acting, how is it affecting people in different age groups, right? This information is very important to departments of health all over the US. It's very important to the medical community in general. That information is very helpful. That data is very important for them to make decisions about how to engage people. The other part for us, I know it can be scary, right? Because the reality is that we, African community, Black community, communities of color, we don't have the best relationships with government, and we don't have the best history with, vaccinations or testings or anything like that. And so I understand the leeriness and the fear. And obviously some of us who are undocumented or have issues with immigration obviously don't want to share our information. I will say this, at least for DC government, that information is not shared with immigration or anyone else. That information literally stays there. So that's not something anyone has to worry about. Also, they're not asking you for your social security. They're not asking you for your debit card. So, these private information pieces that you're worried about, rest assured, those are not part of the questionnaires. What they're asking to know is like, where were you? How do you feel? At what stage? When do you think you caught it? Who are you around? The reason that information is important is because if we can contact someone that was around you, right, who might have been elderly or has a compromised immune system soon enough, then they can stay home, right? And they can self-isolate and they can keep their families healthy and stop the spread of it. Also, they might need to stay home and not go to work, which further expands and blows up the COVID cases, right? So if I don't know that I'm sick, or I don't know that I was around someone who was sick, and I go to work and I work around like hundreds of people, maybe I'm in medical healthcare, and I see patients every day, that's dangerous, right? Because you're unknowingly contributing to the spread of coronavirus, but you don't know that unless someone educates you that you are around someone who has tested positive. Again, I know the tests, honestly, I know the tests are not 100% proof, but it is better to isolate, take the time, stay healthy, and then go back out into the workforce or go back into your regular life before you injure your grandmother or you injure your coworker or you hurt someone, because your system might be okay and it might be healthy enough to handle it, but the next person might not be. That's the other part of it, is we don't know how coronavirus is going to affect each and every next individual. So saying, oh, well, I had it and I was okay, doesn't mean that you should still be out in public giving it or spreading it. Or again, I know a lot of people are unknowingly doing this, so it's not, the intention isn't to hurt people, but even if you don't know, the minute you get tested, if you get positive and you get that call from someone on the task force, please answer all of the questions correctly and give them a chance to provide and get to the next group of people, because you could save someone's life. And that's why it's really important. It is about saving people's life. It is about getting ahead of it and not just behind it. So I think those are the two main reasons.
Yeah, so this information is really very critical. Talking about trust, especially among the Black community, is important, for African immigrant, communities to understand that whatever information you are giving out there, they are confidential. It won't affect you in any way, So for people who are undocumented, right now the priority is we want to mitigate the spread of the coronavirus. The information is not about your documentation. So it's important that you give the right information, your name, your phone number, and possibly your house address, because that's the way to one can actually be able to trace you and provide all the help and all the resources that you need, and to ensure that the state is fine in terms of coronavirus spread. All right. So do not be scared to think that whatever information that is gotten from you will be used against you. And we also know that there are people who try to scam,
Mhm.
using this whole contact tracing thing. So it's important that you know that nobody would ask you of private or personal information such as your social security number. So try as much as you can to have that in mind. So the idea is that we want to be collectively responsible to ensure that the spread of this virus is mitigated and as soon as possible eradicated. We want to go back to our normal lives again and just live free just the way we used to. In rounding up, let's talk about mental health because the impact of COVID-19 is one thing, and mental health is something that is really connected to it. What would you say is the impact of COVID-19 on the mental health of people, and how should or how what ways or what are the ways that one can actually be able to come out of it in terms of having mental health challenges, stress,
Sure.
anxiety, and all of that?
Right. Before I say that part, I do want to reiterate a couple of things. So the people from contacting people around contact tracing, they're not going to ask for immigration status. They will not ask your social. They will not ask for your credit card, debit card, routing number, anything like that. If you hear anyone call you or ask you these things, please make sure to contact Department of Health or contact DC government in some way and report it, or contact, AWCAA and let them know because it's important, right? Like the whole point of this is to get this information out, to connect with people and make sure they're isolating, getting the resources, getting the information that they need. When people take advantage of this and create scams, it's such a sad scenario, but sadly in our day and age, it's very common too. But just I wanted to make sure people understood that part. Mental health, honestly, we've all, I think in some way, we've all dealt with some level of stress, right? Regardless of who we are, where we are, why we exist, whatever. COVID-19 has stressed everyone, right? Whether it has stressed you
True.
because of your finances, whether it's stressed you just being locked up and cooped up in a house, whether you're experiencing any levels of anxiety or depression or fear or any of those things, they're natural, right? Especially during this time. I mean, for 3 months, we were not allowed to go out. We were not allowed to see our family, see our elderly parents, or see anyone who is sick. And a lot of people were dying by themselves. And that in itself is stressful, just knowing that. And then you take on the blitz of the media around coronavirus and all of the information, misinformation it was giving out, the arguments, it's just a stressful time. Like, which is why I think we've seen this humongous growth in mental health challenges. People
Yeah.
experiencing more levels of anxiety, more stress. People, I think I recently also saw a report around, the increase in divorces, right? So it's put a lot of strain on families and couples, and it's put a strain on parents because kids are now at home, doing virtual schooling. And if you don't have like great internet, that's another level of stress. There's so many levels and levels and levels of stress that we're dealing with, for those of us who are also all working from home. That itself is another level of stress. I
True.
think we're all pretty
Yeah.
zoomed out to some degree. And
Hmm.
on top of it, just, it's important. Like physical touch is important. Hugging your family member is important. And sometimes some of us can't even do that. Being away from many of us who live in other states where our parents or our families aren't, that in itself creates stress. So we're kind of living in this weird space in this weird time. And I think as a result of that, all of us are finding some level of mental health issues, right? It may not
Yeah.
be the same for those of us who already experienced mental health disorders or other challenges. This has probably shot it through the roof. Um, but I think honestly, everybody's dealing, even little kids, I think just being stressed from not hanging out with their friends and not being able to go to school or dealing with
Yeah.
difficult tasks online, that's teachers. I mean, I say that to say that mental health right now is not unique to individuals, economics, industry or anything. It's something that we are all experiencing as a result of what's going on today. And it's not just, we're dealing with so many battles, right? For those of us who are living across, who live in the US, but our families are in Africa, there's so many battles in Africa right now. And I think that's also bringing on challenges. I know with Nigeria, they're dealing with, the campaign and SARS, and that's, been a very hard and trying time for that community. And we pray for them to get, the solutions and the results that they're looking for, and hopefully that gets better. But that is also stress.
Yeah.
So I say that to
Yeah.
say that, like, Black Lives Matter, that's a movement and a challenge here in America, a major issue in America that we're also being stressed by, right? For those of us who are part of the Black and minority community, that's, dealing with police brutality is so many levels of stress. And I'm not trying to keep saying how much stress, but the the reality is it's 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 rounds upon rounds upon rounds upon rounds, right? We're just getting hit battle
Yeah.
day in and day out with a new level. Like, let's say today you find peace, tomorrow there's something else that gives you anxiety. But the good thing is people are talking more about it. People are talking about more around mental health issues. So we all know that
Yeah.
it's no longer taboo. At least I don't think it's taboo, right? We all face it. It doesn't matter if you're a doctor or you are the janitor. It doesn't matter if you're the president, side eye there, or you are anybody else. Everybody is dealing with some level of mental health. And
Sure. Sure.
you um, and so as a result of it, I think hopefully we can try to destigmatize what it means to deal with mental health issues and provide more resources. I love that I'm seeing more and more webinars with therapists,
Mm.
psychologists, analysts, anybody who can talk about it, give us data, give us coping mechanisms. I'm loving that more and more people are engaging in meditations and yogas and quiet time and reading. I love that there's more YouTube videos around
Yeah.
discussions about different ways to cope with mental health. There's books. Um, Actually, Charlemagne the God, who was like a very well-known radio person, wrote a book on mental health, and I
Yeah.
actually had a chance to read it, and I thought it was a really good book because he talks about his own problems, but then there's a psychologist who actually breaks down different scenarios and explains different things. So it's a good book
Mm.
on dealing with mental health, and especially people who come from the Black experience in America, and how you deal with mental health and how it shows up in our lives. So there
Yeah.
are resources. I think we just have to get away from this fear of being labeled something, right? And
Yeah.
recognize that we're all right now working through something individually, right? Collectively, we are all dealing with some form of anxiety, some form of stress. Even if we don't show up on Zoom like we have any stress, we all have stress, right? And so
Yeah.
reality is, I think it's okay to talk about it. I think it's actually important. I think, because of social media, we feel like we have a network of people, but we're also lonely too. Like, the data shows that even though you're connected to a lot of people, that a lot of people feel isolated and by themselves. And I think it's important. This is the time where I think it's important to engage with people, like authentic
Sure.
relationships that are not online or not on the, you know what I mean? Find people in your community, find people in your family, find people in your friend group that you can have authentic, honest conversations about how you feel, what's going on in your business, what's going on in your life, how you're stressed. Because sometimes we just need an outlet to just vent, right? Sometimes that in itself
Sure.
becomes that. And other times we need doctors and we need medicine and we need like classes and we need programming. And if that's where you are, then you need to explore that and find resources for yourself. Or if that's a friend, look for resources for your friends.
Yeah.
I'll say mental health is a big deal. Let's try to destigmatize it by recognizing that no one is exempt from mental health issues right now. So whether your health issue is anxiety, that in itself is a challenge, or whether it's something way more drastic. And then the other thing is that there are resources, whether there are resources online, there are resources that are books, there are webinars that talk about this. There's also like call-in hotlines that I've noticed are going up more and more on mental health,
Yeah.
suicide, and different, there are these things are the difference between our sanity and our insanity. I don't want to say that. I don't want to say sanity. They said, but between having a good day and having a not so great day, right? Because we all deal
Yeah,
with challenges.
that sounds better.
Yeah, I'm sorry. You know,
Yeah,
yeah,
yeah. So that's you know just you just talked about this mental health issue for like uh 7 to 8 minutes, so it's like, okay, Helen is an expert. While you were talking, I was like, it looks like Helen is an expert in this area, because you just lit up, and then you just had to provide a lot of information there, and you brought it home for us, because everyone is going through one level of stress or another, one level of anxiety or another. uh, as an organization, we work with breast cancer people living with breast cancer, and just the mere fact that I am immunocompromised, or there's a likelihood that if I, contract COVID-19, I probably would have severe complications from it, makes one naturally feel that level of stress or a level of anxiety. The thought that, okay, I don't have to go to the hospital as compared to everybody. I have to go if it's an emergency. I don't have to always go to the grocery stores just like any other person. Those are things that people experience every day, and they think that, okay, I have to be extra careful. I have to do this. I have to do that. That in itself is a lot of stress, and the world is chaotic already. A lot
yeah,
of things are going on, so it can contribute to the level of stress. And one thing I would also advise people to do is reduce if you know that going to social media will increase your stress level or anxiety level, just try as much as you can to just leave it out, reduce the screen time. If it's the television, the news and everything,
mhm,
reduce screen time, okay? And try as much as you can to practice self-care. That
yes,
would help you reduce that level of stress. Exercise, that's really very important. We've talked about it earlier. And AWCA also provides psychosocial support, so if you need to if you're feeling stressed and you think that you need to talk to someone, you can call us. We have that capacity to provide psychosocial support to anyone who really needs it. So uh, if you need to talk, call AWCA. We'll always be there to receive your call and talk to you. And we have professionals who would also attend to, anyone who calls us. Okay. So one final word from you, Helen. We've had a very nice conversation, and I think it has empowered a lot of people. Um, it has thrown more light on a lot of things around COVID-19, contact tracing, case investigation, and everything that is going on in not just in DC, but even in the US in terms of COVID-19. So, what would be your last word for us all as we round up?
Um, honestly, like COVID has been an enlightening experience, honestly, right? We've
Yeah.
all kind of had to take, a look around ourselves, our families, our communities, and see what's going on. And in the middle of crisis, I feel like this is actually a time for us to be more together, like be more sensitive to each other, be more caring, more loving, and be more honest and authentic. I think a lot of times people try to hide things or their situations.
Mm,
And if you don't get that information out to someone who can potentially help you, support you, there are resources. And I say that because I know that there are resources. I know that you're an organization filled with so many resources. And I just want people to tap into that, right? So if you say, I have food issues, or if I have housing issues, or if I have a mental health issue, or if I have an issue just with income and employment, start somewhere. Start with an
mm.
organization like yours, contact you guys, and you can help them spread out and get the resources that they need, because that's the only way you're going to solve your problems. And the other part that I really hope that people really understand is that, like, please keep your mask on. We as Africans, we love to gather, and that's a great part of our community. But don't take it off in the middle of the gathering, right? Because then that just defeated the purpose. So keep your mask on, wash your hands, do everything you're supposed to be doing. And then at the same time, you need to invest in yourself. I know resources may be a challenge, but eating healthier, investing in your mental health, Like you said, reduce social media if that creates anxiety. Reduce your time watching TV if that creates, or watching the news if that creates anxiety. Like, pay attention to yourself. This is important. Like, you only get one health, and if you destroy it right now, or if you allow it to destroy you or your family, then it's going to be a bigger situation. So just do what you have to do, right? And get the help that you need. And I pray and I hope that everybody's safe and healthy, not just here, but all over the place. And so let's just end crisis, this crisis eventually, I hope. And now it's
Yeah.
the second wave, right? We're seeing numbers go up, actually. So that's the other thing. We're seeing numbers
Yeah.
go up. Now we have flu virus season. We have the cold coming in.
Mm-hmm.
We got to dig in deeper at this point. Like, it's going to get a little bit worse probably before it gets better. And I'm hoping that everybody does exactly what they need to do and is mindful and doesn't think that coronavirus is over. Like, it seems like it's just getting into stage 2 of itself. So let's take care of ourselves and take care of our communities.
Thank you very much, Helen. I'm really excited about today's webinar because it's full of lots of information that can actually help our community, to be better at what we're doing in terms of education and, trying to ensure that people don't really get infected with coronavirus, and also to stop the spread of it, across the entire country. So thank you very much for this wonderful time. Thank you for sharing your thoughts with us. Thank you for sharing your expertise with us, and all of the information that you've shared with us today. We're really grateful and we appreciate that. Thank you to everyone as well who has watched this webinar. Please share with your friends as well, because this is really very important. So if you've enjoyed something good, share with others so that they can also benefit from it. All right, so thank you everyone for
Thank you,
joining
Chris.
us. Thank you, Helen. And we would have subsequent webinars. We intend to have more webinars. We have one more webinar this month. That's on the 25th of October. That will be the last webinar for this month. We have several webinars for next month. So stay in touch with us, and we'll keep bringing you information that would help you rise above this pandemic and stay healthy. All right. So thank you, everyone. Take care. And bye. Bye, Helen.
Thank you, Helen.
Thank you, Miss Iffy.
Yeah,
Thank you,
okay.
Miss Ife.
Yeah, okay. Bye,
Bye.
everyone.
Yeah.
All right, bye-bye.